General first aid and emergencies. It's every parent's nightmare that your child will have a serious emergency and you won't realize it, or you won't know what to do. You actually don't need to be a doctor or an EMT to help in an emergency. Not that doctors or EMTs aren't helpful or necessary, but any person can help. The first few minutes of any emergency can be really crucial, and in most emergencies, what is needed in those first few minutes is not that hard to do. If you haven't learned CPR, it's a good idea to do so. The Red Cross and the American Heart Association offer classes all over the country. It only takes a few hours, and you can literally save lives. Even if you never need to use your skills, knowing that you have them brings a lot of peace of mind. We'll walk you through some common emergencies and talk about what you can do. As we go through, we'll assume that you haven't taken that CPR course yet, or if you have, use what you learned. A bleeding wound. Every parent deals with this at least once, often more than once. What to do first? Put pressure on the wound to stop the bleeding. A cloth or clothing works well. If the bleeding stops or slows down, clean the wound well with soap and water and take a good look. If it is deep or the edges gape open, it likely needs a stitch and you should go to the emergency room or your doctor's office if they can do stitches. If not, put on a bandage. If the bleeding doesn't stop or slow down, especially if it's a big wound, you'll need to go to the emergency room. If you can't keep pressure on the wound while you go there, call 911. Choking. Your child may be choking if they're having trouble breathing and can't talk. They may have their hands at their neck, they may look pale, and they may faint. If they're coughing, let them cough. It's when they can't cough that you should worry. What to do first? If you're in a public place, yell, "My child is choking. Does anyone here know CPR?" If nobody answers or you're not in a public space, call 911. The dispatcher can talk you through what to do. If your child is a toddler or older, grab them from behind, grasping your hands together in a fist just below the ribs, and pull in hard. Repeat this several times. Stop if they start to cough or make noise. If your child is a baby, put them on your lap, turn them on their belly with their head pointed down, and hit the upper back with the heel of your hand a few times. Then roll the baby over and push on the belly. Stop if they start to cough or make noise. These instructions don't cover all the steps, so before performing CPR, it's best to take a class. A burn. This too happens to most parents at some point. What to do first? Run the burn under cold water. Next, take a look at it. If the burn is blistering or covers a large part of the body, like all of an arm or leg, or a big part of the trunk, call your doctor or 911 if it's large and blistering. You should also call if the burn looks pale or black, looks deep, if your child is in a lot of pain, or it was caused by something electrical. If the burn isn't blistering or large, cover it with a bandage. If it starts to blister later, call your doctor. A severe allergic reaction. This is most likely to happen in a child with a known allergy, like a peanut allergy, but sometimes the first reaction is a severe one. The child may have hives on different parts of the body, the face may swell, and there may be some trouble breathing. It's also possible that the child might vomit, have diarrhea, or become dizzy. The child might have all or just a few of these symptoms, and they usually come on rapidly. What to do first? Call 911. Lie the child down in a safe place. If you have epinephrine, give it. Passing out. There are lots of different reasons this might happen, from minor ones to more serious ones. What to do first? Get the child lying down in a safe place. If they are already lying down and you aren't sure what happened, don't move them. Call 911 and stay on the phone with the dispatcher. Check to see if they're breathing. You can put your cheek above their mouth to listen and feel for breathing. And if their heart is beating, feel the side of their neck or inside the elbow. If you can't feel one or both, or you aren't sure, let the dispatcher know. If you are in a public place, yell, "Help, does anyone know CPR?" If there is breathing and the heart is beating, stay calm and wait for help to arrive. If the child starts to wake up, keep them lying down. Seizure. The child may have jerking movements, stiffen, or have other strange movements, and not respond to you. What to do first? Lie the child down, on their side if you can, but don't worry if you can't. Call 911 if the child is having trouble breathing, if the seizure lasts for more than 5 minutes, or if the child doesn't respond to you when it's over. If the seizure is less than 5 minutes and the child responds once it's over, bring your child to an emergency room if they have never had a seizure before. If your child has had a seizure before, call your doctor. A broken bone. It's not always easy to know whether something is broken. Sometimes it's obvious, like when the body part is crooked, or worse, if the bone is visible. But most of the time, it's not. When a bone is broken, it hurts a lot. It's hard to move, and the child may feel dizzy or nauseated. If you're not sure, assume it's broken until a doctor tells you otherwise. What to do first? Make sure they are in a safe place. But if you are moving them, move the affected part as little as possible. If it's possible, have them lie down. Go to an emergency room. If they're in extreme pain or you can't get them into a car safely, call 911. A bad bump to the head. Kids bump their heads all the time, but sometimes a bump to the head can cause a concussion, or worse. What to do first? Have them rest. If they were playing in a sports event and bump their head, they must not return to the event. Talk to them. Look for bruises. See how they're acting. If they lose consciousness, or they're very sleepy and it's hard to wake them, or they have severe pain, call 911. If things aren't that bad but your child isn't acting right in any way, go to an emergency room. Otherwise, call your doctor for advice. Poisoning. It's amazing what kids can get into. What to do first? Get the container of whatever they took, and as best you can, figure out how much they took. Call the Poison Control Hotline at 1-800-222-1222 with both the container and your child near you. They will tell you exactly what to do. Eye injury. What to do first? If something got into the eye, flush it. Contact lens solution or saline are best. But if you don't have those, just use tap water. Plenty of it. Important. Don't flush if the eye itself was injured, particularly if there is bleeding or an object in the eye. Call 911 if there is something large in the eye, if the eye is obviously injured, or if a liquid that got into the eye burned the face. If after you flush the eye, your child is no longer in pain, call the doctor. If you can't reach the doctor or your child is still in pain and the eye looks very red, go to the emergency room. Knocked out tooth. What to do first? If it's a permanent tooth and not a baby tooth, you need to act fast. If you have the tooth, put it back in the space it fell out of. Or if you can't, put it in milk. Call the dentist whether it's a baby tooth or a permanent tooth. If it's a permanent tooth and you can't reach the dentist quickly, go to an emergency room. Hopefully, you won't have to use any of this information. If you have any questions about anything in this video or about first aid in general, talk to your doctor. Thank you for watching this video on keeping babies safe.